Hi, everyone. Thank you for joining us today. You have ended up in the session, as you can see on your screen, addressing maternal mortality and morbidity through father engagement. We're so glad that you picked this topic in this session. I think it's going to be a great discussion. I'm really excited to listen and learn as well. My name is Abby Cannon. I'm the evaluation manager with the Maternal Health Learning and Innovation Center. And we're happy to bring the Maternal Health Learning Innovation Symposium to you this year, second annual, and the second time we've done it virtually. We are hoping that next year we might see some of you in person. But for now, we are excited to have this opportunity through Zoom to be able to bring us all together in this space today to have this discussion. So I will go ahead and introduce our speaker today, and then I will hand it off to her. I do invite you, if you would like to put your name, introduce yourselves briefly in the chat to say who you are, where you're joining us from today, and anything else you would like to share about what you're excited to learn today or what you're working on in your own work. So first, I will start then with introducing our speaker. Latrice, this is Latrice Rollins, Dr. Rollins. She is an assistant professor at the Morehouse School of Medicine in the Department of Community Health and Preventive Medicine. Dr. Rollins is also a Robert Wood Johnson Foundation Culture of Health leader whose work is focused on father engagement and father-inclusive practices in maternal child health, violence prevention, and other public health and social work priority areas. She provides father engagement training for practitioners in various sectors, and she is the editor of the book, Engaging and Working with African American Fathers, Strategies and Lessons Learned. So we are pretty excited to have her here today to share what she has learned through some community-based participatory research in Georgia. And without further ado, I will go ahead and turn it over to her. Dr. Rollins, take it away.
Thank you so much, Abby. Thank you all for coming and joining us for this session on today. I'm honored to be able to speak with you. And so what I'm going to do is turn my camera off because I am in Atlanta. And as you all know, the storm is kind of moving across this way. And I don't want anything to kind of interfere with our connection. So the objectives of this discussion are really to describe the importance of father involvement, particularly in maternal and child health, describe, as Abby said, some community-based participatory research projects that we've worked on, which include a father-inclusive framework for maternal and child health practice, research and evaluation, as well as policy. And I'll talk about some strategies for engaging fathers in maternal and child health, particularly with some Healthy Start programs and other maternal and child health services that I am partnering with here in Georgia. And then you all have not heard, and maybe you have heard through other sessions, unfortunately, Georgia is at the bottom of the list when it comes to maternal mortality and morbidity, particularly for Black women. And so a lot of these projects, actually all of these projects, are focused on Black maternal mortality and morbidity. So I'm going to start us off by walking through a bit of a visual history of fathers in maternal and child health. And you may have heard or even experienced days when fathers stayed in the hospital waiting room while their partners were in labor. Then once the baby, or get this going here, in this case, when babies were born, there was a room where the babies were put in cribs and they had a little nameplate and the father could see their child through the glass. And although, fathers really protested this level of separation from their partners and children in the 1940s, it wasn't really until the 1970s that hospitals and doctors gradually permitted fathers to actually be in the delivery room. And so father involvement during this process, we can see it has evolved from waiting to watching to actually being a part of the delivery process, to now fathers are even encouraged to have that skin-to-skin contact time with their child. And so research has even demonstrated that this particular time, right after the birth of a child, is called the magic moment. And it's called this because, one, for the most part, the hospitals and OBGYN offices around the time of pregnancy are where both of the partners are, both of the parents are. And the magic moment right after the baby is born, it's really signifying this time of abundance of positive feelings. You may notice or you may recall that the signing of birth certificates, the paternity acknowledgement, any type of resources, all of these things generally come right after the baby is born, because it has been recommended through research that this is when, again, there's a positive feeling amongst the parents and a good time to kind of introduce things, particularly that will benefit the couple and the baby. So with that, as our culture and our parental roles evolve, so must our practice and our policies. And so while I've been talking about labor and delivery, now there has been more emphasis on involving fathers prenatally and even during preconception. So there are multiple positive outcomes when fathers are involved during pregnancy. As we see here on the slide, back in 2010, the Commission on Paternal Involvement in Pregnancy Outcomes strongly recommended the full inclusion of fathers in prenatal care in order to reduce and eliminate racial and ethnic disparities in perinatal health outcomes, in particular in the US. We also know from research that father involvement during pregnancy is associated with early prenatal care. In fact, fathers that are involved with the pregnancy, we know that mothers are 2 times as likely to go to their prenatal appointments in the first trimester when dads are involved. There's also decreased risk when dads are engaged for maternal psychosocial stress. Also, when dads are engaged, there's a higher likelihood of positive maternal behaviors, including their dietary intake, as well as breastfeeding initiation or the decision to breastfeed, reducing the risk of preterm labor, and also that reduced risk of low birth weight. So multiple outcomes there, and we have the research that support this, but I really would like us to do an activity to highlight another very important point to support fathers in their roles in maternal and child health and their roles in families. So I'm going to stop here. And this activity is called Who is the Father of the Year? And I'm going to read a brief description of 4 dads, and I want you to vote for one dad, only one dad, who will receive the Father of the Year award. Now, there are no right or wrong answers. I'm going to put a link in the chat, just a moment. And I want you all to use that link to respond with your vote. All right, now let me go back so that we can get those descriptions. So we have Alfonso. He's nicknamed the VIP dad. He has a high-paying job. He has a pretty stable marriage, works long hours, he travels, he's moderately affectionate, minimally engaged. We have Ching. He is an underemployed dad. He has some part-time work, pretty stable marriage. He works from home, but bored. He's not the breadwinner, quote unquote. He's mildly affectionate. There's no night duty. And we have Chris. He is the non-resident dad. He has low paying jobs. He's never been married. He works regular hours. He has a small apartment. He's highly affectionate. He's fairly engaged. LaRon, he is a stepdad. He is employed in full-time construction. He has a pretty stable marriage. He works regular hours. He gets paid paycheck. He lives paycheck to paycheck. He's mildly affectionate and does good night duty. So with these 4 descriptions of dads, I want you to use the link in the chat and vote for who you would say is the Father of the Year. And I'm going to give you about 2 minutes to kind of look at these descriptions and go and complete that task, and we'll come back and share. There is no select all option. You just have to choose one based off of the description here. About one more minute to go to the chat and click that link and make a vote for who is the Father of the Year. Okay. So far, it looks like there's an overwhelming number of votes for Chris, the non-resident dad. Would anyone like to unmute and tell me why you selected the father that you selected? And it can be anyone, Chris, LaRon, or Alfonso. You can unmute, or you can put in the chat why. We're a small enough group. We can be interactive.
I liked him because he said he was very affectionate and supportive.
Okay. Others?
So I also selected Chris for the same reasons, but also for the fact that he had a stable job with regular hours, so he could be more reliable, you know, during the certain times of day and things like that.
Mm-hmm. Others?
I think I chose Chris. Oh, because it also said he was fairly engaged.
Mm-hmm. Okay. Okay, I see in the chat, Lisa says that she chose LaRon because he seemed to have a stable home and would help with night duty. And Abby agreed, she thought that night duty was also an important factor. How did you all, I guess, what was your conception or perception of night duty? What did that mean?
This is Lisa. Well, since I said that, my perception of night duty is somebody who doesn't just roll over in the bed, but is willing to get the baby, change a diaper while mom's getting ready to feed, hopefully to breastfeed, but if she's not going to breastfeed, to, you know, get the bottle ready for the baby, then if the baby's going to bottle feed, and be involved so that mom actually has a chance to get up and go to the restroom before she starts having to deal with the baby, or even takes the baby to do feedings at night.
Mm-hmm. What did others think about night duty? Let's see, supportive of his partner and taking care of his baby. Okay. What about those who voted for Chris because it says fairly engaged? What did that mean to you?
Hi, this is Crystal. I took that to mean that although he's not living in the same home as his child, that he is still engaged or involved with the child's care as much as he can be.
Okay. Other thoughts on engagement and kind of how you perceived engagement, whether it was minimal or fairly engaged? I know this would be easier if we were in Baltimore, but feel free to unmute or you can put in the chat.
Hi, this is Crystal again. Now that I'm reading these, I almost want to, after reconsidering what these different bullets could mean, I almost want to change from Chris to LaRon.
Why so?
Well, in thinking about LaRon being in a pretty stable marriage, that can suggest, I guess a feeling of responsibility and commitment to the mom, to his family, and working regular hours, again, commitment, responsibility, and then being able to provide, night duty, even though it says good night duty. I mean, I think any kind of night duty is good night duty. And my perception of what night duty means is pretty much, I think, what the other participants stated. And that is somebody who's willing to be the one to be responsible for caring for the baby overnight while the mom rests or does whatever she needs to do or wants to do.
All right. Thank you, Crystal. Okay. So what this activity really shows us is how we add meaning and how we make assumptions and draw conclusions just based on very brief interactions or limited information we may have about our clients. As I tried to pull out, you just have a bullet point that says night duty. What does that mean to you? What is minimal or fair engagement? What's mild affection? What's highly affected? So affectionate. So we have to be very careful about our biases and when we are providing services, not just to mothers, but to their partners as well. Especially when we know that father involvement leads to such positive outcomes, we really have to be very careful about the meanings that we add to their situation. So we just need to, look at what was actually said, what we heard, and really understanding, if any beliefs are coming up as they're speaking with us or sharing with us, and challenging those if it's not grounded in facts or what they actually said. And so I hope that makes sense to you all, because what I find is that father engagement in maternal and child health, it does lead to such positive outcomes, but it is such a major change. And I think it's primarily because it requires such a mind shift. And so therefore, in order for us to really get to a point of including fathers in services and making sure that, that they are feeling welcomed in that experience, we really do need to challenge some of the biases and some of the things that we think about how fathers should be versus just where they are. And I see some things in the chat, so I want to acknowledge those. Okay. All right. Thank you, Ms. Williams. All right. So the Florida Maternal, Infant, and Early Childhood Home Visiting Program, they provide this model for father engagement and inclusion. And the model shows just really how intentional we have to be about father inclusion and engagement. It has to be a commitment to engage or include fathers on several levels. So starting with the participant or the individual, that can be the mother and the father. Also, it starts with the staff. Also, there has to be change and intentionality on the program and systems part. And it also includes our attitudes as well as our actions. So it's not just about knowing what to do or knowing best practices and knowing how, but it really has to do a lot with our attitudes towards fathers at each level. So I want to go through a couple of examples of projects that we're currently working on around father engagement in maternal and child health services here in Georgia. Morehouse School of Medicine funded us for a pilot project. It is called TX because the T stands for translation. And translation, at least with this particular project, happens when we have a multi-partner collaborative really working on a particular issue, in particular health disparity that we're trying to address. So not just having all of the research or having all of the issue take place in a community engaged space, or not just having everything happen in the clinic, but bringing all of these individuals to the table to work on a particular issue. And in our case, it was maternal mortality and morbidity, particularly among African-American mothers. And so we partnered with the WIC program, the Women, Infant, and Children's program in Columbus, Georgia, the Healthy Start programs in Clayton County here, as well as in Atlanta. Also, in terms of community engaged researchers, that would be myself at the Prevention Research Center. We also had the clinical side, working with Grady Hospital, which is a public hospital here in Atlanta. And they had a centering pregnancy prenatal program. So we worked with them, as well as the Department of Public Health and their maternal and child health section to really kind of capture that health policy and systems side of things. This was a community-based participatory research project, meaning that we had a coalition of not only academic and community partners, but also fathers who are part of the research team that helped to develop the proposal, as well as just everything that kind of happens throughout, developing the instruments that were used, or at least tailoring them, administering them, helping us to interpret the data, as well as helping to present. Our main goal was to identify the strengths and gaps in father-friendliness of these particular maternal and child health services in Georgia. We were awarded that funding in January of 2020. And so therefore, our plans were kind of derailed just a little bit with COVID-19. And so we thought it would be, it would not do justice if we did not talk about the impact of COVID-19 on the fathers, as we're talking about, how father-friendly these agencies are during the pandemic. Particularly, with Grady Hospital, they had a policy that basically the fathers were not allowed. They weren't doing any more in-person prenatal classes. A lot of the clinics were closed. And so anyways, we thought we needed to really address this. We can't just talk about how father-friendly these places are, where meanwhile, we're having this whole pandemic where dads are not even allowed to be in the delivery room or to even attend appointments. So we did 2 focus groups with fathers in Metro Atlanta, as well as in Columbus, which are the areas that's not necessarily a rural area, but it's outside of the metro area in Georgia or in Atlanta. And so we wanted to hear from fathers the types of communication that they receive regarding COVID-19, particularly how it would impact their engagement in services. We wanted to hear about any services or support that they received or needed, as well as any recommendations that they had to improve services for fathers. What they talked about and shared with us is that there really wasn't any communication given to them in terms of the companion or visitation policies of the different providers or of the hospitals. So obviously they recommended that there be more father-specific communication that's given. Also, they wanted to make sure that there are more father-inclusive practices. So just because the father, and this doesn't have to be only during the pandemic, this can be throughout. So just because the father wasn't able to physically go to the appointment or things like that, there is technology, there are ways that, they could be FaceTime or Skype or something like that to be included in the appointment, particularly important moments. The fathers talked about, hearing the heartbeat and, getting updates about how mom and baby are doing. They really wanted to be included in that process. And so using some technology or other, ways would really have helped that. Also making sure that the policies, whether they're visitation or companion policies, making sure that they're standardized across the board. The communication that the fathers received was very conflicting at times. They may hear from the OBGYN that yes, they could go, and then they may get to the hospital and they get turned away. You may have some dads in the very same area. One dad is allowed to go in, one dad is not. So making sure that the policies are standardized across the board. Also, the fathers shared very powerful testimonies about just the impact of not being able to be there in a support capacity, the impact that had not only on their relationship and kind of connection with the baby, but also the impact on the relationship with their partner. Just because they really valued or really had high expectations of being that support and being there, not being able to do that really caused a lot of frustration, caused a lot of communication issues and things like that. So, but we were very glad to hear that the fathers did have a lot of optimistic outlooks in terms of, okay, this was one time and this is, that thing happened, but the baby is here. And so now we have, the rest of the time to spend and be engaged and involved. So they had a very positive outlook on everything that had occurred after the fact. So after we did the focus groups and things kind of started to settle down a bit, we were pretty much well-versed in Zoom and grounded in all of the kind of virtual things that we needed to do. We decided to go forward with assessing the father-friendliness of these maternal child health services, because they then started to resume virtual services and things like that. So we assessed them using the father-friendly checkup, which was revised with our community coalition to make it a little bit shorter and make it more appropriate to the maternal and child health partners. This father-friendly checkup is available free to anyone. It is a tool that was developed by the National Fatherhood Initiative and has been used in a number of different settings. It has 4 domains that they assess in terms of father-friendliness, which include leadership development, organizational development, program development, and community engagement. We had about 40 staff to complete this assessment across the 4 settings. And we also had about 140 dads. We had a little bit more that actually completed this assessment. We also asked for the staff and fathers to complete a measure of fathers' challenges. Another objective of this study was to really identify the programs and services that do exist in Georgia to serve fathers. And so we thought it would be important to ask the fathers, what are some of the challenges that they're experiencing so that we can appropriately match up and find the types of resources and services that they would need. We asked the staff to share with us the types of challenges that they thought fathers were experiencing that impact their involvement. And we also asked the fathers to, share what they were actually experiencing. So I'm going to go through a few results from fathers and the staff perspectives across the domains. This is not everyone, but just an example to give you just a preview of what the results were. For the most part, the fathers did feel as if the staff were very encouraging and had a positive attitude when they were interacting with them. You do see some disagreement in the area of, whether or not the staff encouraged them to have a healthy relationship with the child's mother. It may just be that wasn't really a focus of the conversation or of the services, but for whatever reason, there was disagreement there. And there was also strong disagreement for a few fathers around whether or not the staff helps them understand how to be physically, mentally, emotionally, and spiritually involved as a father. And the staff thought that was really powerful, because it says that fathers don't want to just be looked at as, the providers, or, they really want to be seen whole, like it says, physically, mentally, emotionally, and spiritually. How can they be involved in all aspects and be? So the staff really thought that was powerful, even though it wasn't a lot, but they still saw that. In terms of program development, this particular domain kind of looks at what's offered in terms of services and things like that for fathers. And so the staff thought that they really did a great job in terms of educating mothers about the importance of fathers, making sure that they included fathers in services, that they had literature and activities and materials and things like that would appeal to fathers and addresses certain topics that fathers would be interested in. In terms of what they thought they could improve, was definitely hiring more male staff to deliver the programs and services, as well as periodically asking fathers about their needs and their concerns and any interest that they have as it relates to the organization's programs and services. And then in terms of areas of improvement, making sure, as I said earlier on, with our activity, that we meet the dad where he is and not where they think he should be. In terms of organizational development, the staff thought, that they were pretty good in terms of having a fair and balanced perspective when it came to men and women, or mothers and fathers. They did feel like they could assess situations when the mother did not want the father involved. In terms of the environment, they felt that they did use a gender neutral color scheme in terms of the office and the setting. They felt like they welcomed fathers, that they were also open to constructive criticism as it related to their own personal biases. On the flip side of that, in terms of areas that could be improved, you see a lot of need for training. They really thought that they could have more training as it related to dealing with biases, dealing with how to respond to even the biases that fathers could have, and being trained to spot and effectively respond to those. Also appreciating fathers' parenting styles and any gender differences in their communication styles. And again, just making sure that they were trained on the best practices to involve fathers and engage them in efforts. The community engagement aspect is interesting because it asks a lot of questions about how the organization is viewed in the community. Does it have a reputation as a safe space for fathers, or a place where fathers can go and get resources? It also asks a lot of questions about the marketing and outreach that an organization does. And so you'll see quite a bit of blue, because a lot of this indicates that the fathers didn't know. Obviously, during the pandemic, there wasn't a whole lot of, going out to barbershops or areas where fathers were to advertise or do any kind of outreach. As it indicates here, auto body shops, gyms, basketball, that wasn't a whole lot of that going on. But they were aware of, brochures, videos, PSAs, different things that were appealing to them, and did avoid negative stereotypes, did avoid language and images that, perpetuate a kind of negative image about fathers. with the measure of father's challenges. Again, like I noted, we administered that to staff as well as fathers, just to get an idea of what were some of the challenges that perceived challenges from the staff as well as fathers, challenges that they were actually experiencing. There is some agreement in terms of housing being a very real issue that the fathers were facing, as well as transportation. Where they somewhat disagree is staff felt that, fathers may have issues with incarceration and problems with the law, drug and alcohol use, as well as child support issues. And fathers shared that they had issues with unemployment, again, obviously during this time, the pandemic, not having enough money to buy things for their children, and also difficulty controlling their anger. The next project that I'll share, we've partnered with all of the Healthy Start programs in Georgia, where there are 6 that are led by the State Department of Public Health and Maternal Child Health section. We've partnered with them to really include fathers in nutrition education as well as breastfeeding education. The Healthy Start programs, they offer home visiting services, and they do have metrics around talking about nutrition counseling and looking at maternal weight gain and things like that, but there wasn't really a structured program or structured, curriculum that was being used to really get at those metrics. And so we thought it would be good to address not only maternal mortality and morbidity disparities, but also nutrition disparities with adding this nutrition education. The nutrition education is done by our University of Georgia Cooperative Extension Program. They have a nutrition education program that is free to any resident. And so we partnered with them to provide this education. It's an 8-week session, 8 weeks of nutrition education, going over, healthy, affordable meals, how they can prepare those, how they can shop and budget, looking at also making sure that they, especially during these times, that they're being careful in terms of, making sure that the food is handled in a safe way, all of these different things. But that is one part of this intervention. The other part is making sure that parents also get information about breastfeeding, so that we can really impact the metric around the duration of breastfeeding and understanding. Again, we know that there are benefits not only for the baby, but also for mom. And so making sure that dad also gets that information while mom is getting it was a big part of this project. And so we started this in September of 2020, or at least that's when the grant started. We probably started classes in January of this year. And so far, we've seen a lot of improvement in terms of the nutrition education piece, with 92% of our participants showing improvement in one or more of the diet quality indicators. And then with the breastfeeding education session, we partnered with the WIC program to actually develop a video that engages and appeals to fathers about how they can support their partner through the first few days of breastfeeding. So while it is educational for both, parents, it does really appeal to fathers and gives a lot of content around how fathers can support in those first few days and what mom can expect in those first few days. And so after viewing that video, it's about 45 minutes, we saw that the participants were able to get their percent of items answered correctly in the pretest from 75% to 90%. And the nutrition education classes were typically offered in the evening and virtual. And so we really wanted to make sure that we were integrating this with what was already happening with Healthy Start so that it wouldn't seem like something extra that they had to do. So particularly for the fathers, Healthy Start in this most recent grant cycle of 2019, they have to engage 100 fathers per year. So they've been doing fatherhood classes with the dads, and those are typically 2 hours. So they were able to work with the UGA cooperative extension agent to spend the first hour doing the nutrition education. So then they use the second hour to do their typical, father 24/7 dad or whatever fatherhood curriculum they were implementing. And same with the breastfeeding education. Breastfeeding education was also implemented, virtually. The video is only 45 minutes of the class. So they, had an opportunity to do the pre-post test during the class and then go ahead and finish the rest of their session. Now, we have had to play with this quite a bit with the pandemic, because as probably some of you know, folks get Zoom fatigued at this point. And so we've tried to also offer the class at times that if they missed their session, a Healthy Start session, if they wanted to just kind of meet with us separately and watch the video, at least for the breastfeeding piece, we made arrangements to do that as well. But it seems, at least as far as the best practice or what has worked for us so far, has been just really integrating it with what they were already doing with the Healthy Start sessions. Another thing about this project is that we have 3 sites that are just control sites where they are just doing their regular Healthy Start services as usual. And then we have 3 that are actually doing the nutrition education and the breastfeeding education. And so hopefully by the end of this, which it ends next year, 2022, we will be able to see, some differences, and hopefully if we continue in a positive track, that this will be something that other sites can implement. And so this is the flyer. Again, a number of different ways for folks to contact us if they were interested in participating. All right, now final piece I wanted to share about just how we're doing in terms of really getting at a policy aspect, the systems aspect, and getting multiple folks engaged. I really love this model by the University of Texas. They have a lot of great things on their website. Feel free to check that out, the Child and Family Research Partnership, about just how we transform communities through systems level change. And so it takes a lot of folks at the table. If you all, work with fathers, there are a lot of different things, different challenges that come up beyond just understanding, what it is to be a dad, and to, especially a new dad, and those different things, how to support your partner during pregnancy. There are a lot of things that happen in the course of life that they need to address. So it takes a lot of people coming to the table to support. And the only other thing that I at least add to this model, they have this area here where there's like a question mark area that needs to be fathers, right? We don't need to just kind of be having all the arrows directed to the fathers, but fathers also need to be at the table to say what it is that needs to happen and how that change needs to occur. So in March of this year, we embraced a community mobilization approach, which is also a National Fatherhood Initiative model. And it was really to promote and support father involvement in Metro Atlanta. The first phase of this approach is to conduct a community needs, and we added assets, community needs and assets assessment to really understand what is happening in terms of engaging fathers, where are some of the barriers, what are some of our partners, what are they already doing in this space to promote and support father involvement. And it's called mobilizing because, as I've been talking about, there's a lot of research, there's a lot of data, we have experiences, a lot of things that point to the positive outcomes when fathers are involved. However, it just has been quite an uphill or very slow to be implemented in practice in terms of really engaging fathers. And so how do we mobilize? That was kind of why we call it mobilizing fatherhood. So we did the community needs and assets assessment, included some secondary data analysis, finding out what was happening, doing some focus groups to find out, what folks thought in terms of strategies and barriers. And then in March, we had a leadership summit. We brought together about 200 or so stakeholders from various sectors. So media, faith, social services, health, law enforcement, philanthropy, just a number of different leaders in the community to come together. Because as I said in the previous slide, we need a lot of folks at the table to really get things moving in this space to support fathers. And so with that, a graphic recorder helped us to capture our vision and what it takes, the road to getting there, right? And with that were 7 strategies that came out of the discussion. And those are in the gold along here. So connecting fathers, making sure that they are connected to specific resources, but also making sure that they are connected to each other. So building that brotherhood and that mentorship among fathers is important to this group. Improving relationships between the men and the agencies, as well as improving relationships between parents is also another strategy. Changing the narrative, making sure that we get the word out about positive images about fathers, changing just kind of this deficit perspective that is always that is commonly lifted up about fathers, particularly fathers of color. So that is a big part of the initiative. Reaching fathers, so making a way that even if we have these resources, we have all these tools, how do we reach them? What are the ways to really get them engaged? Supporting inner healing, understanding that mental health, having safe spaces to dialogue and just really address any trauma, anything like that is important as well. Implementing father-friendly policies, understanding that a lot of what fathers are challenged with and a lot of things that are hindering really have political determinants. They have political tones and things like that that really need to be addressed in order for us to really advance in this space. And then addressing mass incarceration was another strategy that we're working with, because that has such a great impact on the families in our communities. So right now we are in the phase of anchoring this initiative, which means we have implementation committees for each of these 7 strategies. Again, they are multi-sectorial, so folks are from all different types of sectors, working together to advance action plans for each of these strategies. Again, with the goal and vision to really develop a system that serves fathers as well as it serves moms and babies. Okay, and you heard from 2 of the members earlier this morning. If you were in the male engagement plenary session, 2 of the members of this collaborative, Mr. Calvin Williams and Mr. Wesley Buggs, they are leaders in this work as well. So here are some resources I'd like to share with you. There's a lot of work that has been done in terms of putting out toolkits, putting out fact sheets, just a number of different ways that folks have shared about engaging fathers in maternal and child health spaces, whether it's in home visiting, whether it is in the clinic, in the provider's office. There's a lot of resources here. I'm also will plug my book as well, which has a chapter written by Dr. Patrice Sams, Abiadun, and Dr. Deborah Copeland in New Orleans, talking about the supports that new and expecting fathers need. So lots of resources available. And with that, I will end. If you all have any questions, happy to entertain those. And would just obviously like to acknowledge my partners, the Strong Fathers, Strong Families Coalition of Georgia, the Georgia Healthy Start Collaborative, as well as the Fathers Matter ATL initiative, our community mobilization approach. And obviously want to acknowledge my research assistant extraordinaire, Tiara Giddens, who helps me get everything done. So I'll stop with that.
Thank you so much for such a wonderful presentation. This was fascinating and such an important topic. So I really appreciate you sharing with us today. Yeah, I'd like to just open it up for questions and comments from you all today. I see one question from Jeff. Based on survey results presented, I agree that the male staff is needed to deliver services as men like to talk to men, but there are few males in the home visiting field. Any strategies on how to get more males into the field, such as incentives or targeted recruitment?
Mm-hmm. Yeah, and so that's such a great point. There's a lack of males in health and human services, period. And so it really does take a targeted effort to let men know and be explicit about, we really do need you in this space. We do need you and welcome you in this work. So, making that explicit as partnering with fatherhood organizations like what you heard about earlier today, Reaching Our Brothers Everywhere. They have a discussion focused specifically on man-to-man, talking about maternal and child health, talking about breastfeeding, what they can do in that space, supporting each other. And so working with organizations that are in this field and just partnering with them to let them know that we need them and we do want them to be a part of this work. Definitely making sure that we have funding to really support those positions. That's something that we're currently working on, what are called OB navigators, or you may have the term community health workers, making sure that we have funds to really target and recruit men in those spaces as well, to really help the dads, because we've seen that work, particularly in one of our partner sites had a male community health worker that was working specifically with expecting fathers, and they just enjoy that so much, talking with the father about, what to expect and things like that while their partner was pregnant, but funding ended, and so we really need to make sure that we encourage more men to be in the field and support them financially.
Got about 5-7 more minutes in the session. I just encourage you to come off mute if you'd like and ask your questions or put them in the chat.
Hi, Latrice. This is Crystal again from Chicago. And can you just briefly explain to me again the difference or the similarities between father engagement versus father involvement?
Mm-hmm. So they're kind of like a ladder, right? A continuum of sorts. So there's father involvement, father engagement, father inclusion. And so father involvement really has to do with, like, we have something and we want dads to come. So we invite them in and they do our thing and they go, right? Father engagement is where, they're really at the table to kind of help with envisioning what that looks like and what those needs, and making sure that their needs and services are being more tailored to what they think should happen. Father inclusion is kind of that optimal space where things are designed specifically for fathers, and that they're also at the table to make sure that they're, again, this is something that they really want. So there's kind of a continuum in terms of father involvement versus inclusion. And folks start where they are, you know, it's all good to me. But you know, it really depends on the organization and their readiness to do so. Yes, we're working on that. I don't know if anyone ever kind of works with the state, but there's a lot of kind of red tape and things that have to go through before we can release things to the public. There may be another state that has a WIC video, particularly for dads, but I would have to really follow up with you on that.
If it does become available and you want to share it more broadly, you'd be welcome to reach out to MHLIC and we'd be happy to share it. It sounds like such a great resource and supporting that. We'd be happy to.
Yes, it is really great.
Hi there. Can you hear me?
Yes, Ms. Berry, how are you?
Oh, good. Sister Latrice, you did an exemplary job. Thank you so much.
Oh, thank you.
And I really do, I really do agree with your differentiation between the father involvement and engagement and inclusion. And I would just like to uplift another component of that you're discussing, and that is the meaningful male inclusion, period. In making sure that the work that we do, fatherhood is embedded in our practice. And as you've already alluded to policies and so forth. So thank you for that. But I just wanted to uplift the being embedded in our organization practice. Thank you.
Yes, thank you. Absolutely. And I share with the team all the time, if I go away, who's going to champion this work? You know, it has to be in the policies. It has to be in what we just do, you know, because if you just have one fatherhood coordinator who's off over here and this is just what he does or she does, when they leave, who's going to kind of carry on the work if it's not embedded in the mission of the organization, if it's not embedded in the organization's policies and procedures, it'll just be a thing that we have to come back to when somebody else gets inspired to do it, you know? So yes, I totally agree with that, Ms. Berry.
Hi, I'm just wondering, are you aware of any materials or are you working on any materials for younger audiences like middle schoolers? So, you know, boys and girls can learn about the importance of all this work and they can learn about each other's reproductive roles. And what about that?
Yeah, so not me in particular, but I know that with the initiative, some of our partners have talked about bringing teen girls and teen boys together to have discussions and things like that, kind of under that umbrella of improving relationships. So understanding early how to communicate with each other and just learning more about even teaching the young men about like child support and all of these different things that can happen. Should you have a have a child and not prepared and all of those things. So the partners have been talking about something along those lines. There's also a lot of talk about preconception work and things like that, particularly with our young boys. And so again, that's something that's in the works, but we haven't fully like delved into that yet.
Okay, thank you.
Well, if there's not any other questions, we're about just right on time to wrap up. I want to thank you, Dr. Rollins, again for sharing with us today and about this very important and often overlooked piece of motherhood that is so important and critical to both engage and include at all levels. So thank you for sharing today and about your participatory research. I also know there was a lot of questions from the fathership panel in the forum or in the Q&A in the app. So those here, if you have questions or have ideas or responses to those questions, I encourage you to hop over there and continue the discussion in the forum or in the Q&A under the fatherhood panel. Thank you so much for joining again. And we have about a 15-minute break before the next sessions begin. So thanks a lot. Have a great rest of your day.
Thank you for your attention.